A very warm welcome to all the viewers tuning into Doordarshan Kendra Kohima. Health is the foundation of a strong community, and today we are going to discuss on some initiatives taken up by the government of Nagaland to strengthen the healthcare through various welfare schemes. So stay tuned with us as we bring to you expert insights and inspiring stories. I'm Imtila, your host for today's top form, Nbtc. National Blood Transfusion Council in Nagaland was established to facilitate the regulation and licensing of all blood banks managed by State Blood Transfusion Council under the Directorate of Health and Family Welfare, supported by DGHS. Today we have with us our experts, Mr. Ali Poker, the founding president of Voluntary Blood Donors Association and the assistant director of BTS, Mr. Ainato Yapto, chairman of Voluntary Blood Donors Association and deputy director of NSEX. So, if you are a regular donor or someone interested about blood donation or just here to learn, this talk show is for you. So, sir, thank you for joining us. We look forward to a meaningful discussion. So, to start with, could you kindly enlighten us about NBTC and its roles and deliverables?
The National Blood Transfusion Council, this is established in the year 1996, and it was through the decision of the Supreme Court of India. And likewise, after that, it's been established in all the states, like under the State Blood Transfusion Council, and they are a regulatory body where the framework, the legalities, and all the implementation guidelines are being issued from the state. So this is basically to strengthen the blood donation movement and establishing of blood banks, and to, you know, in some ways to check the professional blood donors, because there are lots of before this there was a lot of issues regarding people who are professional blood donors. Basically, they are who sells blood. So to check that, the Nbtc was established, and likewise in our state also it was established, and it's been about 20-25 years now. And because of this act of the Supreme Court, our state is now very much free of professional blood donors, and that's where the blood donors comes in. So basically the State Blood Transfusion Council is functioning as a regulatory body where they emphasize on the quality of the blood and the legal issues, where blood banks are being established, where there's no blood banks, and where there's a professional blood donor should be done away with, where blood donation should be promoted. So this is what basically the State Blood Transfusion Council does.
Okay, so we would like to know how it coordinates with the state level bodies as well.
In our state, we have in all the states there's only one SBDC, that is the State Blood Transfusion Council, and under them, for example, if some hospitals in the government setup I'm talking about, if they want to do, if they want to establish a blood bank, then they have to obtain approval from the SBDC, that is State Blood Transfusion Council. They have to give the NOC. Then only after that they have to go through all the legalities, and then the Drug Control of India will issue the license. So as of now, we have only 3 blood banks in our state, which is basically in Dimapur, Kohima, and Mokshu. There's other districts they are on the way of working towards achieving the licensed blood banks, but at the moment we have only 3 blood banks, and the other districts, they have blood storage centers. So that is how the SBDC is functioning.
Okay, great. So as being said that a lot of efforts has been made for the quality of for better blood transfusions and all. So we would also like to know how the NBTC ensures the safety and quality of blood donation.
See, in all the blood donations that we are doing in our blood banks, there's a means to check that the blood is safe. For example, we have mandatory screening of blood for HIV, for hepatitis B, for hepatitis C, for with syphilis, sexually transmitted diseases.
Yes,
let's
correct.
put it that way, and malaria. So these 5 are mandatory to be screened. So whatever the blood that is being transfused from the licensed blood bank, there 100% we have to say that it's safe.
Yes.
But if you're taking blood from unknown source, or maybe in a life-saving effort, if it's in a private hospital or a clinic, then we cannot assure the quality, because these are not in a regulated system, they are out of the system, but sometimes it happens.
Yes.
I'm not saying that it's happening every day, but sometimes in a life-saving effort, sometimes it happens.
Correct.
Very rare cases. But those blood which are being transfused from the blood bank, these are, we can assure that it's 99%, it's safe.
Okay. So, sir, you being the founding president of Voluntary Blood Donors Association Nagaland, we would like to know more about the organization and also how the Nbtc is promoting it.
Our blood donation, we all have been donating blood for a very long time, but we felt that we should have some coordination among us, and some like-minded people. We talked about it for some 2-3 years, and in the year 2011 we came together, and some like 10-15 of us, we came together. We said that come on, let's do form an association where we can help other people.
Yes.
So that's where we joined forces, and since 2011, 12, 13, there's no looking back, and we've grown leaps and bounds.
Yes.
And as of now, I'm proud to say that our governor of Nagaland is our chief patron, and we have patrons. I'm not going to name all of them, but we have prominent people who are like philanthropists, and we have patrons, and we have people who are there with resources, and then we reach out to those people because they want to contribute to the people, but they don't know where to spend or they don't know where to give. So we reach out to those kind of people, and we've been doing that in over the last 10-15 years, I should say.
Yes.
And we've been doing a tremendous job.
Yes.
We are sacrificing our blood, our time, our money, but it's not for me, it's not for
Yes.
you, it's for the people, those who are in need.
Yes.
And our chairman is also here,
Yes.
and he'll talk more about that.
Yes.
But our association, we started from a very small, kind of a kitchen thing, but now it's grown to such a big, wonderful organization that people like
Yes.
they come to us
Yes.
every time when there's a need of blood.
Yes, I've also noticed the works that the Voluntary Blood Donors Association has been doing. I'm also there in that WhatsApp group where I've seen that you and your team have reached out to a lot of people and that have been encouraging blood donation as well. I've also been to that program, that the one conducted at Red Cross, and it was quite an inspiring day. So we thank you for that. As mentioned by our expert, Sir Ali Poker, the efforts has been made by the Nbtc as well as the Voluntary Blood Donation Association. So we would like to know, if an individual wants to be a part of the blood donation drive, how do they enroll and how do they get access to all these blood donation plans?
Thank you, MT and the DTK for the opportunity to share about the importance of voluntary blood donation. Like our founding president have already shared, started in 2011 with like-minded people. So over the years, we found that it's important to have a social media page and account. So in Facebook and Instagram, they can always reach us to us. It's simple as this, like a Voluntary Blood Donor Association Nagaland, and even we have a WhatsApp group. So any individuals who are in record of blood, they can always reach to us. And in the past, 4 or 5 years back, we thought through social media also we cannot able to reach out to many individuals and people who are in need of blood. That's why we started with the Nagaland Blood Donors app. This is the first app which is developed by our state, and it was developed by the Blood Donor Association Nagaland. So through the app, they can always go to the Google Play Store and then download it. It's simple as that, it's a Nagaland Blood Donor app. So through this app, they can register as a blood donor or as a recipient of the blood. So whenever the patient is in need of blood, they can always go to the app and then they can find their own blood group. There are various blood groups, so they can always find their own match blood groups, and then through that they will have a contact number. So every individual who are free to donate, they will immediately respond to that call to donate the blood. So this can always reach us to the blood donor app as well as social media.
It is wonderful to know that we have access through such as Instagram accounts, WhatsApp group, and also app that is available in Play Store. So with that, we would also like to know, is there enough blood banks and storage facilities in the region, and how self-sufficient is Nagaland in meeting the blood transfusion needs? Would you like to support this through some statistics?
In our state, we have only, as I've mentioned, we have only 3 licensed blood banks, which are in Dimapur, Kohima, and Mokchung. The rest of the districts, they are coming up because we have 2-3 medical colleges coming up. So definitely there will be blood banks there.
Yes.
Other states, other districts, they are in the process of establishing, but due to some logistics issues, the full-fledged license is not being issued, but they already have a blood storage center license for that. So they can store blood. And our state, on an average, let's just put it on an average. Say we have around a requirement of around 20,000 in our state. So out of that, in our government hospitals, we've collected, last year we've collected around 16,000. So the rest on an emergency basis, sometimes it happens in the private hospitals also. We can't deny. But these are, life-saving efforts. So 1,000-2,000 may be done in the private hospitals that we are not accountable, or they are not accountable to us, and so we cannot give you the specifics. But in the government hospitals, we collect around 16,000. Last year we collected around 21,000, but that was because of the rise of the dengue cases in the summer. But this year dengue cases was not so much, so we collected around 16,000. That is in the 3 blood banks. So on an average, 15,000 to 20,000 is the requirement. And I will say this, that if all the eligible blood donors did donate even once in a year,
Yes.
we'll have more than enough to suffice the state needs. But our people, we are a little reluctant to donate blood, and awareness is also a little low. But if the eligible people who are 18 years and above and 65 years and below, if they can donate once in a year, or maybe once in a lifetime, because I've met so many people who have never ever donated once in a lifetime. So I'm not saying that they should donate like every 3 months, every 6 months. So at least once in a year, or maybe once in a lifetime, it'll be enough to suffice our needs.
Yes.
You can just go to the hospital, just visit any point of time. You just go to the hospital. There are people lying there in the hospital for the need of blood.
Yes.
They're just, especially the cancer patients, dialysis patients, people with chronic liver diseases, and so on, and so forth. So people are there just waiting for blood, and we people, sometimes we just shy away to donate blood. So we should rise up to the issue, rise up to the occasion. At least donate once in a year, and it can be you, it can be me, it can be your family members. We never know. So if you just go up, donate blood once in a year, more than enough to suffice.
Yes, that is correct. That is so true, because I've also met a lot of people who are like so scared of donating blood, and the only excuse they give me is needle get bui like So going back to the next question, I just wanted to ask, like, I'm sure there will be some challenges faced by the hospital as well as blood donors and other allied agencies. So would you like to address those challenges, and what are the initiatives taken by the central as well as the state government to take up these initiatives to put awareness about blood donation?
See, the challenges when it comes to blood, like my friend have already mentioned, like we're a little bit reluctant, and then lack of awareness was one of the most key findings we have found that. But over the past 2-3 years, we are very happy to see different group of section of people, like youth organization, churches, they are coming forward for a voluntary blood donation. But still there's a challenges, like you have mentioned, needle ke bui khai, or but still now we have challenges in the requirement of the blood, because to able the better healthcare services and all, people from the far-flung district, they come to Kohima and Dimapur. So at times like we used to get phone calls even at midnight also in need of blood. So it became a very challenging thing. So the my fellow friend will share about the technical thing, but as a blood donor association, we have formed this WhatsApp group, or this we have developed this app and all. So these are the things which we have developed to at least meet the requirement of the blood. And then we do like awareness and all in the college with the youth organization and churches and all. So slowly people are coming up for voluntary blood donation. But still there is a huge requirement of blood, and especially when we face any challenges like the cases of dengue and all, the cancer patient. As we know, in Nagaland we have lots of cancer patients, kidney dialysis and all. So these are the section of people which require blood regularly. Some do like even for leukemia and all, like some they need like 6-7 units of blood in a day also. So in order to meet these challenges and all, like we used to face lots of difficulties in finding the blood groups and all. And then not see there are some certain group of people who have a negative blood group, like O negative, B negative, and A negative. So these are the people, like the population size of the population is too less, and then it became very challenging for us to meet the requirement for this B negative WhatsApp group. So our association have been promoting and advocating this section of people to form a WhatsApp group also, so that when in times of crisis and all, they can help each other. So these are the few steps which we have taken, and then we also tie up with different section of people and group, or we also involve the Assam Rifles, the paramilitary forces and all, so that during midnight or crisis time, they always come forward to help us. So these are a few the issues or findings which we have taken up to meet this requirement of the blood in our state.
Yes. It is great to know all the initiatives the department and other allied agencies has been taking up. As we all know, any successful policies happen only because of some dedicated individuals who work tirelessly regardless of what time it is. As our experts have mentioned, they are available even during the midnights, because whenever whenever there is an emergency, they are always there for the public. So we thank you and we really appreciate your efforts. And we also like to know that the allied agencies, the medical departments had been advocates about blood donation. So could you kindly explain the steps taken up to the to take this awareness about blood donation to the rural community, and what are the events lined up for this year as well?
Officially, as per the department, we've been taking up the issue very aggressively, and we are trying to promote blood donation in the rural areas, especially in the grassroots level, because if we sow now, we'll reap maybe in a few years, because students and young people who are in the rural areas or in the villages and the towns, not basically in the urban areas, so as they grow up, we want to inculcate the importance of blood donation, so that as and when required and as they come up, they will be a blood donor. We try and tie up with the churches, because church is one of the most important platform in our society where we can reach across all the sections. So we try and tie up with them. It's not, I'll be very honest with you, it's not possible in all the areas, but as far as possible, we're tying up with them, and we try and tie up with the local clubs, the youth clubs and all those. So state-wise, as such, specifically, we don't have a specific program under the state government, but this program is looked after by the Director General of Health Services from the Ministry of Health and Family Welfare, and through that, our medical department, we emphasize. So of course, I'm not denying that our state is not helping, but we should do more, to be very honest.
Yes.
To promote the blood donation, because like I said, it can happen to anyone. And we have a specific program where it should be only for blood. We have a specific for HIV. We have a specific for TB. So these are parallel programs are going on. So state, we need more dedication. We need to divert more resources, which state is doing, but we need to create more awareness.
Yes.
In the grassroots level.
Yes.
So that's what I feel.
Just to add up, my fellow friend have said, this year we have regarding events, Coming up is the June 14, that is World Blood Donors Day, and October 1 is National Voluntary Blood Donation Day. So these are the big event in a year which we observe every year. And just recently, our team, the Voluntary Blood Donor Association Nagaland, we traveled to 11 district to promote the voluntary blood donation, and also to have a proper blood donors group in every district. So I believe like through these recent activities where we have advocate this voluntary blood donor association to have a in a district.
Yes.
I believe this June 14 will be a massive one in Nagaland, so that at least everybody should aware about this importance of voluntary blood donation. So I believe this year it's going to be a very massive, and people are coming forward to observe this important day. These are the days which we acknowledge the blood donor, like, and to be every individual should be at least once in a lifetime there should be a blood donor, so that at least once in a lifetime if you are a blood donor, then you're saving someone's life.
Yes.
So it's very important. So I believe this June 14 and October 1 will be a massive one in Nagaland this year.
Okay, great. Thank you so much. And we would also like to know, like, if there is any myths or any kind of message that you would like to share to the public.
We should just imagine that blood donation is a health checkup for ourselves, because when we do blood donation, you are being screened for HIV, Hep C, VDL, and malaria, and all those. These are basically done free. That is one. So instead of going to the hospital to do all the tests, which will cost you maybe 1 or 2 days, and if you go to a private clinic, it will cost you more than 3,000 rupees. But these are all done free. That's one. So it's a health checkup for you, and only healthy people donate blood. So if you're not healthy, then we will not take your blood. So if you are a blood donor, that means you are healthy, number one. Number two is that blood is being made in our body every day, every second. And you donate or you don't donate, it's being destroyed within our body. So instead of just getting it wasted, give it to somebody. And blood is not like you have a headache, you take a pill and then you fine. It's not like that. Blood is taken when the situation is dire. That if you don't take blood, then the person will die. So these are the situation. So your 5 minutes of time, your 300 ml of blood will save somebody. It's a 5 minutes for you, but it's a lifetime for somebody else. So I want to take the message across. What I want to say is that just give. The joy of giving. And we, as a human being, we always want to take, and we don't want to give. I mean, I'm not talking about the blood alone. No, we always want to take something. We want to have, we want to get, but why not start giving? It's about a life for somebody else. So I just want to say to the people who are eligible to donate blood, if you are sick and weak, we'll not take your blood. If you're healthy, give it. Because automatically it's a health checkup for you. Then once you donate blood, then your body will start making fresh blood again. And if you don't donate also, it'll be just wasted. So start giving. Save someone's life.
Yes, thank you so much.
So let's, like my friend has said, let's give blood, this precious blood, and just save someone's life. And I just want to put across one message to the parents, especially the mother. Encourage your child to be a blood donor, because if your child is a blood donor, that means he or she is living a very healthy lifestyle. There's no sickness such as like HIV, hepatitis B, C, malaria, and so on. So please encourage your child to be a blood donor, so that through these by giving blood, that means your child is in a perfect health status, like he's practicing a healthy lifestyle. So I think if together we can make a difference and make our state a healthier and more happy society and community.
Thank you so much. So dear viewers, I hope this discussion program has been enriching for you. Let us all remember that all of us we all are responsible here, and me as a donor, we should know that every blood donated is a beacon of hope for someone's life. So as we conclude this session, I would like to thank our experts, Sir Ali Pokra and Sir Anato, for sharing with us your expert insights, and to you, our viewers, for tuning in. Stay tuned to Doordarshan Kendra Kohima for informative programs, and until next time, stay inspired. Signing off, Imtila.